Just washing my hands. Hello, Ms. Heron. My name is Terese Rossi. I'm a nurse practitioner student, and I'll be assessing you today. How are you doing?
Good, how are you?
Good. Are you comfortable in this room?
Yes.
Good. So patient's mood is not depressed, her affect is not flat, her demeanor is not irritated or agitated, her general appearance is alert, calm, cooperative, her dress is appropriate for my assessment right now, her hygiene is intact, she looks clean, she's 65 inches tall, she's 127 pounds, which means her BMI is 21, which is normal. Her stature is upright, she's not slumped over one way or the other, and she looks well nourished. So now I'm going to start by inspecting and assessing your lungs and your thorax. So if you could turn to the side here. So her lateral thorax is larger than her AP diameter, and her skin is normal for ethnicity. There's no lesions, redness, rashes, there's no bruising to her ribs. There's no lesions, redness, masses, no bruising to her ribs. Her rib cage rises and falls symmetrically. There's no intercostal retractions during inspiration. There's no use of accessory muscles such as her sternomastoid, scalene muscles, or any supraclavicular retractions. As I said, her thorax rises and falls symmetrically, no unilateral lag or delay. Her breaths are regular and unlabored at 18 breaths per minute, and there's no audible wheezing. So I'm going to start pushing down your back here. Any tenderness or pain?
No.
Good. So please say 99.
99, 99, 99, 99.
So tactile fremitus is normal. There's no increase or decrease tactile fremitus. I'm going to put my thumbs at your 10th rib and take a deep breath in and out. And one more time. So her thorax rises and falls symmetrically. There's no decreased lung excursion. So now I'm going to tap on your back. I'm listening for resonant lung sounds, and resonant lung sounds are heard throughout her posterior thorax. Now I'm going to ask you to blow a deep breath out and hold it. I'm listening for an area of dullness, which starts just about here. So now I'm going to ask you to take a deep breath in and hold it. And the other area of dullness starts just about here. So that space is about 4 centimeters, which is her diaphragmatic excursion. Now I'm going to listen to your lung sounds. Take a deep breath in and out. So vesicular breath sounds are heard throughout. Bronchial breath sounds are heard over the mainstream bronchi. Both are normal, but there's no adventitious breath sounds, no rales, no rhonchi, no wheezing or crackles. Please say E.
E, 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 E.
So the E does not sound like an A. The sounds are actually very muffled, so, telling me that egophony is not present, which is normal. Now please whisper 1, 2, 3. So the sounds are actually inaudible, telling me that whisper pectoliloquy is not present either, which is normal. So now I'm going to move to her anterior and her lateral thorax. So let me know if there's any pain. Any pain or tenderness?
No.
Great. Please say 99.
99, 99, 99, 99.
So tactile fremitus is normal with no decreased or increased tactile fremitus. So now I'm going to listening for resonant lung sounds again. So lung sounds are resonant over the third and fifth intercostal space. There's an area of dullness, which is where the heart sounds are, which is normal. So now I'm going to auscultate. Take a deep breath in and out. So vesicular breath sounds are heard again over her anterior and her lateral. Bronchial breath sounds are kind of heard more on the right-hand side, but both are normal. There's no adventitious breath sounds, no rales, rhonchi, wheezing, or crackles. Please say E.
E, 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 E.
The E does not sound like an A. The sounds are muffled, telling me that agophony is not present. Whisper 1, 2, 3. So the 1, 2, 3 was actually inaudible, telling me that whisper pectoliloquy is not present as well. So now we're going to move to your cardiovascular system. So Ms. Heron, I'm going to ask you to lay back on this pillow. And I'm having her lay in a 30-degree angle, which is what I need for her cardiovascular system. So first I'm going to inspect. I'm looking for any heaves, any lifts, any visible pulsations. I'm going to have you turn to the side. And there's no jugular vein distension noted. So now I'm actually going to, while I'm up here, I'm going to palpate for her carotid. So her carotid pulses are palpable at a +2. And again, while I'm here, I'm going to auscultate using the bell of my stethoscope. Take a deep breath in and hold it. Good. Take a deep breath in and hold it. Good. No bruits are heard, but her carotid pulse is brisk and smooth. So now I'm going to palpate using the finger pads of my fingers. And I'm feeling for any heaves. No heaves are felt. Now using the ball of my hand in the same anatomical positions, I'm feeling for thrills. And no thrills are felt. So now I'm going to feel for the point of maximum impulse. I'm going to start with 4 fingers. And once I locate it, I can move to 1 finger. And that is the point of maximum impulse. So now I'm going to move on to auscultating your heart sounds at 5 different positions. First on the right hand side at her second intercostal space, which is the aortic area, using the diaphragm and the bell, moving over to the second intercostal space on the left hand side, which is the pulmonic area, moving down 1 intercostal space to Erb's point, moving down 2 intercostal spaces, which is the tricuspid area, to the midclavicular line, which is the mitral area. So S1, S2 heart sounds are heard, but no murmurs are heard. So please lay on your left side, left lateral, perfect. So same anatomical positions, the aortic, the pulmonic, down to Erb's point, down 2 to the tricuspid area, and over to the midclavicular line. And this position is really good for listening to S3, S4 heart sounds or any mitral murmurs. And S3 or S4 heart sounds are not heard and mitral murmurs are not heard. So now I'm going to ask you to sit up and just lean forward a little bit. Perfect. So at the second intercostal space, again at the 5 positions, the aortic, the pulmonic, Erb's point, tricuspid, and the mitral area. And this position is really good for hearing any mitral murmurs as well. But again, S1, S2 heart sounds are heard, but mitral murmurs are not heard. So now I'm going to move to her peripheral vascular and lymphatic system. I'm going to start by assessing her skin. So her color is normal for ethnicity. There are no color changes up and down her arm. Her color stays the same. There's no redness, no lesions, no rashes. Her skin is warm to touch up and down her arms. There's no coolness noted. The texture is smooth and dry. There's no edema. There's no swelling. Her arms are symmetrical in size and proportional to her body. Her cap refill is under 2. And same with her legs. Her leg color is normal for ethnicity. There's no changes in color from any point in her legs. Her skin is smooth and dry. There's no lesions, no redness, no rashes, no peripheral vascular ulcers. Her temperature is warm to touch. There's no swelling, no edema. The legs are symmetrical to each other and proportional to size. And her cap refill is under 2 seconds, and her hair distribution is, well, the hair is evenly distributed. So now I'm going to palpate. Checking her radial pulses at +2. And her radial pulses at +2. Brachial pulses at +2. And brachial pulses at +2. Now I'm going to check for epitrocular lymph nodes, and none are palpable. Epitrocular lymph nodes, and none are palpable. So now I'm going to ask you to lay flat. I'm going to feel for your femoral arteries, or pulses, I should say. And +2 pulses, and +2 pulses. Moving down to your dorsalis pedis. +2 pulses. Your post-tibial pulses. And I'm going to feel for your popliteal pulses. And while I'm back here, I'm going to feel for any popliteal lymph nodes, your popliteal pulses, and feel for any popliteal lymph nodes. Great. So now I'm going to auscultate. I'm going to auscultate your aortic artery, your renal arteries, your iliac arteries, and your femoral arteries. Over to your renal. To your iliac. To your femoral arteries. And no bruits are heard to any of her arteries. So now, since you're in this flat position, I'm going to assess your abdominal area. For inspection, I'm looking for shape and contour. Her abdomen is flat, non-distended. Her abdomen is symmetrical. Her left side and her right side are symmetrical to each other. There's no bulging. There's no scars. There's no redness, lesions, masses. Her umbilicus, which is midline, has no signs of inflammation. There's no bruising around her umbilicus. There's no visual peristalsis. There's no visible aortic pulsations. Can you lift your head up just a little bit? And there's no visible hernias as well. So now I'm going to auscultate. I'm going to auscultate all 4 areas of her abdomen. And I hear bowel sounds are present, but they're not hypo or hyperactive. I'm going to ask you to take a deep breath in and hold it. And no friction rub is heard over her liver. And take a deep breath in and hold it. And no friction rub is heard over her spleen. So now I'm going to move to percussion. So I'm going to ask you to sit up for me. And at your costovertebral angle, I'm going to kind of pound on your back a little bit. Any tenderness or pain?
No.
Any tenderness or pain?
No.
Great. Lay back for me. And now I'm going to percuss over her abdomen. And when I percuss, I'm listening for sounds of tympany and dullness. I'm going to hear more tympany. Tympany is the prominent sound, especially over the gastric bubble, over the intestines or air-filled spaces. Percussing over her bladder, which her bladder is actually a tympanic sound right now because it's empty, telling me that her bladder is empty. But dullness will be heard over organs such as the liver and the spleen. So now I'm going to percuss for her liver span. So starting in the mid-clavicular line just below her umbilicus, I'm going to percuss up till I hear an area of dullness. Then I'm going to, percuss down until I hear an area of dullness. So that's the upper and lower border of her liver, and that is her liver span. So now at the 6th rib, at the mid-axillary line, just below the cardiac dullness, I'm going to percuss for her spleen. And actually, the fact that there's more of a tympany sound is telling me that there's no spleen enlargement. Please take a deep breath. And again, the predominant tympanic sound is telling me that there's no spleen enlargement. So now I am going to palpate. I'm feeling for her aorta, and I can feel a pulsation, but it is not bounding. Now I'm going to do light palpation. I'm feeling for any rigidity, resistance, tenderness. Any tenderness or pain?
No.
Great. Can you lift both knees up for me? Good, and I'm going to deeply palpate. Again, looking for any tenderness, especially rebound tenderness, any resistance, any muscle rigidity, any guarding, any tenderness or pain?
No.
Good. And over her bladder, there's no bladder distension noted, and her bladder does not rise above the symphysis pubis. So now I'm going to place my hand behind your 11th and 12th rib and ask you to take a deep breath in. So feeling for her liver does not feel enlarged, and it does not feel firm. Do you have any tenderness or pain?
No.
Great. And same thing over here with her spleen. Take a deep breath in. And her spleen is barely palpable, but no firmness, enlargement noted. Any tenderness or pain?
No.
Okay, perfect. And that concludes my assessment.